Normal fluorescein angiogram. Choroidal fluorescence begins 10 to 12 seconds after dye injection in young patients and 12 to 15 seconds after injection in older patients. Early choroidal fluorescence is faint, patchy and irregular, called the choroidal flush. Areas of choroidal filling and non-filling become more distinct, called patchy choroidal filling. Ciliary retinal artery fills during this phase. Ciliary retinal artery, when present, fills in the choroidal phase before the filling of the retinal arteries. The dye is more brighter in the ciliary retinal artery than the retinal arterioles that just begin to fill. Arterial phase starts 1 to 3 seconds after choroidal fluorescence with filling of the central retinal artery. After the central retinal artery begins to fill, the dye flows into the retinal arterioles, precapillary arterioles, the capillaries, the postcapillary venules, and finally the retinal veins. Arterial phase of the angiogram showing the filling of the arterioles. Note the patchy background choroidal fluorescence. Early arteriovenous phase. The fluorescein dye from the smaller venules enters the veins along their walls, resulting in a laminar flow of the dye in the vein. As the vascular flow is faster in the center of the vessel than on its side, the fluorescein dye sticks to the walls of the vein, another contributing factor for laminar flow. With time, the laminae along the walls of the veins become thicker. At the junction of two veins, laminae of each vein merge, creating a trilaminar flow. Early arteriovenous phase of angiogram showing laminar flow in the veins. Late arteriovenous phase. The magnified view showing the laminae along the walls of the tributaries joining to form a third central lamina, trilaminar flow in the proximal vein. Late arteriovenous phase. The dye completely fills the lumen of the vein. A perifoval capillary network is best visualized at 20 to 25 seconds after the injection of the dye when the concentration of the dye is maximum. The fovea appears hypofluorescent because of the absence of blood vessels in the foveal avascular zone and due to blockage of the background choroidal fluorescence by the increased pigment in the tall RPE cells at the foveae. Recirculation phase begins about 30 seconds after the dye injection. Fluorescence within the vessels reduces as lower concentration of fluorescein recirculates. Recirculation phase of the angiogram showing reduced intensity of the dye in the veins. Late phase. Late phase. Retinal vessels are empty of the fluorescein dye by 10 minutes after injection. Staining of the Bruch's membrane, choroid and sclera result in a diffuse background fluorescence. Large choroidal vessels may be seen in silhouette against this background. Disc remains hyperfluorescent in late films due to staining. Late phase of the angiogram shows marked reduction in the intensity of the fluorescence throughout the fundus.